And also, I will introduce you our chief of the pediatric department, the Dr. Zheng. Dr. Zheng. Yeah, so
Chanda.
So we welcome Dr. Zheng. We have opening. Please.
Okay. Mr. Chanda and Mr. Lina and all of our friends from Cambodia. We haven't seen you.
អញ្ចឹងយើងចាត់ទុកក្នុងអត្ថិភាពព្យាបាលហ្នឹងដែរ
Okay, let's talk about the mechanism of anti-SARS-CoV-2 agents. And we can see this SARS-CoV-2 virus and its conjugate to our ACE2 receptor by spike protein. And the monoclonal antibody block these areas. And the second drug is Paxlovid. It block the protease. It's a protease inhibitor. And then third drug is remdesivir. It's the RNA polymers inhibitors. And then finally, the molnupiravir. It interrupt the replication of RNA virus. There are 4 drugs for early treatment of COVID-19. Please translate.
អានេះយើងចង់និយាយពីប្រសិទ្ធភាពអង្គទីនេះ anti COVID-19 សារ COVID-19 ហ្នឹងទីមួយមិនថ្នាំមួយវា2 3ហ្នឹងយើងប្រើហើយវាមានអត្តពលមិនយ៉ាងម៉េចទោះយើងមើលថែមអាហ្នឹងពិបាកបកប្រែ Okay, doctor, you can continue.
Great. Oh. So this summary of medication for COVID-19 in mild or moderate COVID-19 patients with risk factors, we can use remdesivir, Paxlovid, molnupiravir, and the monoclonal antibody. And when patients have severe COVID-19 infection, and then they need oxygenation or even high flow nasal cannula or the non-reducing mask, the treatment would have dexamethasone and the tocilizumab. And we prescribe remdesivir for them. And when patients develop two critical illness, especially patient was intubated for ventilators, the treatment is dexamethasone. Please translate.
អានេះតកតមួយការព្យាប summary ការយើងសរុបទៅលើការប្រើថ្នាំទៅលើអ្នកជំងឺ COVID-19 ហ្នឹងទី1វាមានអ្នកជំងឺដែលរាងសភាពស្រាលហើយនឹងមធ្យមទី2អ្នកធ្ងន់ធ្ងរហើយអាចុងក្រោយនេះអ្នកដែលធ្ងន់ធ្ងរបំផុតហើយអានេះ critical COVID-19 ហ្នឹងអញ្ចឹងយើងមើលប្រភេទអ្នកជំងឺដែលប្រឈមមុខហ្នឹងគេប្រើថ្នាំអីយើងមើលក្រោយមានតាម category របស់វានេះមានថ្នាំនៅក្នុងហ្នឹងហើយយើងមើលតាមហ្នឹង
Here are the table of evidence for monoclonal antibody for SARS-CoV-2. And we can see most monoclonal antibody are not effective for Omicron variant. Let's translate.
អានេះលទ្ធផលដែលគេបង្ហាញទៅលើការព្យាបាលដែលបង្កើតឲ្យមាន antibody for COVID-19 ចំពោះ Omicron.
So let's talk about the first priority drug, Paxlovid. Paxlovid has 2 components. One is nirmatrelvir and another is ritonavir. Nirmatrelvir is a protease inhibitor. It has antiviral activity against all coronavirus. And another component, ritonavir, that is a strong cytochrome P453A4 inhibitor. And it is a pharmacokinetic agent that would make the nirmatrelvir cut the concentration to therapeutic range. Please translate.
ថ្នាំរបស់វាយើងមាន2 component ហ្នឹងគេហៅថា Paclovid នេះវាមិន2ចូលគ្នាវាមិន Nematrivir នេះហើយនឹង Ritonavir អញ្ចឹង mechanism របស់វាគឺខាងលើហ្នឹងគឺវាបង្អាក់ឬក៏វាប្រឆាំងទៅនឹងសកម្មភាពរបស់មេរោគកូវីដហ្នឹង Coronavirus ហ្នឹងកុំឲ្យវាខ្លាំងកុំឲ្យវាចុះខ្សោយហើយRitonavir នេះគឺវាទៅធ្វើឲ្យcytochrome នៅក្នុងអាហ្នឹងនៅក្នុងកោសិការបស់យើងធ្វើឲ្យវាខ្លាំងឡើងដើម្បីបង្អាក់សកម្មភាពរបស់វាគឺ boost pharmacokinetic របស់វានេះវាធ្វើឲ្យសកម្មភាពរបស់ថ្នាំហ្នឹងខ្លាំងឡើងដើម្បីឲ្យstrong cytochrome របស់យើងនេះខ្លាំងកុំឲ្យមានការinfection ខ្លាំងទៅអាហ្នឹង
Okay, the topic and the timing on the Paxlovid should use within 5 days of symptom onset. And the dose is Neotrelvir 300 milligram with Ritonavir 100 milligram and twice daily for 5 days. But we need to we should decrease the dose of Neotrelvir to have when patients have the renal function between 30 to 60 milliliter per minute. Please translate.
អញ្ចឹងយើងមើលដូសថ្នាំរបស់វាហើយនឹងពេលវេលារបស់វាថ្នាំខាងលើNematrivir ហ្នឹងគឺយើងចាប់ផ្ដើមឲ្យលេបតាមមាត់ដែលអាចលេបមួយថ្ងៃ2ដងហើយអាចប្រើរយៈពេល5ថ្ងៃហើយចំពោះអ្នកជំងឺដែលមានGFR ហ្នឹងអ្នកជំងឺតាក់ទងមួយតម្រងនោមអាហ្នឹងយើងកាត់ថយដូសមកវិញមកត្រឹមអាចជាមួយនឹង100 milligram
អូខេយើងប្រើរយៈពេល5ដែរ Okay, and we should avoid Paxlovid with population below. The younger than age less than 12 years old, the body weight less than 40 kilograms, and the patient with liver cirrhosis type C, and the patient has chronic kidney disease with eGFR less than 3 milliliter per minute. Please translate.
ហើយករណីដែលយើងលើកលែងចំពោះក្រុមមនុស្សដែលមានអាយុតិចជាង12ឆ្នាំហើយគីឡូរបស់គាត់ហ្នឹងតិចជាង40គីឡូហើយអ្នកដែលមានជំងឺថ្លើមហើយអ្នកមួយទៀតអ្នកជំងឺដែលមានខ្សោយតម្រងនោមដែលយើងធ្វើឲ្យ GFR ហ្នឹងវាតិចជាង30 cc ក្នុងមួយនាទី
Okay, and in addition we need to know the Ritonavir. That's a CYP3A4 inhibitor that will cause complex drug-drug interactions. And because most of the patients with risk factors, such as cardiovascular disease, they may have many medications for chronic illness. So they may have complex drug-drug interactions. And we may use the Liverpool website to search the drug-drug interaction before we prescribe Paxlovid. Please translate.
អានេះយើងប្រើថ្នាំរួមវាមានRitonavir ហ្នឹងដែលយើងប្រើតាក់ទងជាមួយនឹងជំងឺ COVID-19 ហ្នឹងដែរប៉ុន្តែគាត់ថាអ្នកជំងឺដែលមានជំងឺបេះដូងមិននឹងហាមប្រើមកប្រើដាក់ប៉ុនមិនទាន់
Okay, and then this is the Paxlovid studies from New England Medicine. And we can see each arm has about 1,000 vaccinated patients, and the symptoms will onset within 5 days, and then they have at least one risk factor for severe COVID. And the result is Paxlovid can make COVID-19 related hospitalization or deaths decrease about 88%.
Like
Please translate.
បាទដល់ឡៃនេះដូចគ្នាដែរសិបពពួកឆ្នាំអានេះយើងបកប្រែទៅវាពិបាកដល់យើងយកមើលលឿនយើងថែមបាទ Okay doctor you can continue.
Okay. Okay, this is the website of Liverpool, and we can have first search for the drug-drug interaction. So before we use Paxlovid, we should check on the Liverpool website. And it also provide a Liverpool app, so you may use your smartphone to search quickly. Please translate.
ហ្នឹងអានេះគាត់ថាយើងចង់ដឹងពីការប្រើប្រាស់ថ្នាំច្បាស់លាស់តាក់ទងជាមួយអ្នកជំងឺណាមួយយើងគាត់ឲ្យចូល website Liverpool នេះចឹងយើងអាចបើកមើលបាន website គេទួយ
And the second drug. Okay. Continue.
បានអត់ ចឹងនេះ website គេដាក់នៅលើហ្នឹង
Okay, the second drug is molnupiravir. It's a prodrug of NHC. It's here, and it's a ribonucleoside that can broad antiviral activity against RNA virus. And so it can make the SARS-CoV-2 virus to be non-infectious and unable to replicate. Please translate.
តែដូចគ្នាដែរនេះសិតតាក់ទងមេកានីសរបស់ថ្នាំរបស់អីតែយើងមើលលឿនយើងថានេះ
And its dosage is 800 milligram twice daily for 5 days, and it's also given within 5 days after symptom onset. Please translate.
អានេះនិយាយវីដេអូរបស់វាដែរយើងចាប់ផ្ដើម800 មីលីក្រាមវាស្មើនឹង4គ្រាប់ហើយចឹងយើងអាចលេប2ដងក្នុងមួយថ្ងៃរយៈពេល5ថ្ងៃដែរ
And we should also avoid the population below. First is a patient younger than 18 years old because it has effect on bone and the carriage growth. The second is pregnancy because it may cause fetal harm. And when patient has breastfeeding, we should prescribe within 4 days after the final dose. Another, because it has teratogenic effect, so when patient prescribed molnupiravir, they should have contraception. For women, it's 4 days after the last dose, and for men, at least 3 months after the last dose. Please translate.
អញ្ចឹងដូចក៏បានប្រាប់អញ្ចឹងក្រុមដែលយើងក្រុមមនុស្សដែលយើងលើកលែងប្រើទីមួយក្មេងពេកក្មេងអាយុតិចជាង18ឆ្នាំកាលណាយើងប្រើទៅវាធ្វើប៉ះពាល់ទៅលើការលូតលាស់របស់ឆ្អឹងហើយស្ត្រីមានផ្ទៃពោះអាចប្រើទៅអាចធ្វើឲ្យកូននឹងរលូតអីយ៉ាងទៅហើយមួយទៀតជំងឺកំពុងអំបៅដោះកូន4ថ្ងៃដំបូងយើងអាចបន្ទាប់ពី final dose ហើយមួយទៀតអ្នកដែល sexual intercourse នេះ
Okay, and it has an advantage because we don't need to adjust dose in renal or liver impairment, and it doesn't have obvious drug-drug interaction. Compare Paxlovid. Please translate.
តែវាមិនមែនគុណប្រយោជន៍របស់វាដែរដោយសារថ្នាំហ្នឹងគឺវាអត់មានដូសសម្រាប់អ្នកតម្រងនោមអ្នកថ្លើមខ្សោយឬក៏អ្នកដែលមាន obvious drug interaction.
Okay, here are the research about the molnupiravir move-out study, and it's also prescribed in non-hospital and unvaccinated patients within 5 days after symptom onset. And the result is it causes 30% decrease in all-cause hospitalization or death. Please translate.
នេះនិយាយពីនេះរបស់ឆ្នាំទេយើងដូចបាបបកផែដែរមើលថែមទៅមានភាគរយមានអីគេឆ្នាំណាដែលយើងប្រើទៅមិនអីមិន Okay, doctor, you can continue.
Okay. So the third drug is remdesivir. It's RNA polymerase inhibitor. It can inhibit viral replications. Its dosage is through intravenous infusions. And for mild or moderate COVID-19, the first day is 200 milligrams once, and then 100 milligrams on day 2 and day 3. And for severe COVID, we prescribe 200 milligrams once, and then 100 milligrams day 2 to day 5. Please translate.
ហើយនេះយើងនិយាយពីគុណភាពមេកានីរបស់ថ្នាំហើយនឹងឲ្យដូសរបស់ថ្នាំអញ្ចឹងដូសរបស់វាថ្ងៃដំបូងថ្ងៃទី1ដំបូងយើងចាក់200មីលីក្រាមហើយថ្ងៃទី2ថ្ងៃទី3យើងបន្ត100មីលីក្រាមដល់ថ្ងៃទី2ថ្ងៃទី3ចំពោះអ្នកដែលមានសភាពស្រាលឬក៏មធ្យមនៃ COVID-19 ហើយថ្ងៃដំបូង200មីលីក្រាមដែរអ្នកមានជំងឺ COVID ធ្ងន់ធ្ងរហ្នឹងយើងចាក់ថ្ងៃទី1យើងចាក់200មីលីក្រាមហើយថ្ងៃបន្ទាប់ទៀតថ្ងៃទី2ដល់ថ្ងៃទី5ហ្នឹងយើងចាក់100មីលីក្រាម
Okay.
5ថ្ងៃដូចគ្នាខាងលើ13ថ្ងៃ
And we should be certain about the population that their GFR less than 3 millimeter per minute, because the remdesivir has adjuvant of cyclodextrin that with accumulations in human bodies. Please translate.
ហើយតកតងជាមួយករណីពិសេសចំពោះអ្នកដែលជំងឺដែលមានតម្រងនោមហ្នឹងគេឲ្យយើងចាក់ដែលមានការប្រុងប្រយ័ត្ន
Okay. In addition, we need to avoid remdesivir in patients with abnormal liver function, especially more than 10 times above normal upper limits. Please translate.
ហើយតកតងជាមួយជំងឺថ្លើមទៀតដែរក៏គេឲ្យយើងប្រុងប្រយ័ត្នកាលណា liver enzyme របស់វាហ្នឹង more than វាលើសពី10ដងនៃធម្មតារបស់វាក៏យើងឲ្យយើងប្រយ័ត្នយើងដល់ដែរមិនតេស្តមើលហ្នឹងចាក់យកមក
Okay, here are the study of remdesivir in early COVID, and it's also involved in non-hospital patients and vaccination within 7 days of symptom onset, and they would have 1 risk factors for severe COVID, and the result is at 28 days. And the COVID-19 or all-cause hospitalization or days decrease around 80%. Please translate.
អានេះការសិក្សាថ្នាំរបស់គេដែលគេរកឃើញនៅគេសរសេរជា journal public គេឲ្យយើងប្រើថ្នាំដូចគេសរសេរនៅក្នុងហ្នឹងអញ្ចឹងយើងចាំមើលថែមរបស់យើងទៅស្អីខ្លះមានភាគរយមានអី Okay, doctor, you can continue.
Okay, so I summary the medications for mild to moderate SARS-CoV-2, and we mentioned Paxlovid, remdesivir, And we need to know because these two drugs has best effect on the hospitalization or death. So we should choose the first two drugs in the patient. And the molnupiravir, we should given maybe we don't have the Paxlovid or the remdesivir, or they are contraindicated for these two drugs. Please translate.
តែនេះយើងជំរឿនក្នុងការប្រើថ្នាំទៅលើអ្នកជំងឺដែលមានសភាពស្រាលនឹងរាងមធ្យមរបស់ជំងឺ SARS ឬ COVID-19 ហ្នឹងថ្នាំទី1គេហៅផាក់ឡុកស្វីហ្នឹងយើងប្រើទៅលើក្មេងដែលអាយុលើសពី12ឆ្នាំហើយទម្ងន់របស់វាលើសពី40គីឡូទៅយើងប្រើរយៈពេល5ថ្ងៃដូចគ្នាអាហ្នឹងវាអាចជួយបន្ថយអ្នកជំងឺទៅរកភាពវិវត្តទៅរកភាពធ្ងន់ធ្ងរហ្នឹងបាន 88% ហើយបើយើងប្រើរ៉ាំឌីស៊ីវីនេះយើងប្រើមួយអាទិត្យអាហ្នឹងអាយុក្មេងដូចគ្នាដែរលើសពី12ឆ្នាំហើយគីឡូវាលើសពី40ដែរហើយវាអាចបន្ថយប្រសិទ្ធបន្ថយនៃការស្លាប់របស់វាហ្នឹងឬក៏ការសម្រាកពេទ្យហ្នឹងរហូតដល់ 87%.
Okay, and we should note that the days of the drug when we prescribe Paxlovid or molnupiravir, we should people have the symptom within 5 days. If the symptoms more than 5 days, we don't need to prescribe Paxlovid or molnupiravir. And the remdesivir is 7 days. Please translate.
ហើយបើយើងប្រើម៉ូលីពីរ៉ាវីនេះវិញកាលណាស៊ីមតូមរបស់វាហ្នឹងតិចជាង5ថ្ងៃយើងអាចប្រើអាហ្នឹងបានហើយតែប្រើបានតែក្មេងលើសពី18ឆ្នាំឡើងទៅវិញហើយ12ខាងលើនេះស៊ីមតូមរបស់វាចាប់ផ្ដើមពី5ទៅ7ថ្ងៃ
Okay, and here are the list for medication for severe or critical SARS-CoV infection. I don't spend much time to hear, just go around. So when we face the severe or critical SARS-CoV, the first drug is dexamethasone, and the dose is 6 milligrams once daily for 10 days. And the second drug may be remdesivir, and the dose we have mentioned before. And the third drug is tocilizumab. That's interleukin-6 inhibitor, and the dose is listed here. Please translate.
អញ្ចឹងគាត់ថាគាត់អត់ចង់ចំណាយពេលអានទៅលើអានឹងយូរច្រើនដែរគាត់ឲ្យយើងមើលថែមទៅហើយកាលណាបើយើងចង់ប្រើថ្នាំដុសបត់ដេកសាដំបូងយើងអាចប្រើទៅរហូតដល់6មីលីក្រាមបន្ទាប់មកយើងចាំប្រើលាយមួយរ៉ាំឌីស៊ីវីហើយចុងក្រោយគាត់ឲ្យប្រើស្អីគេតូស៊ីលីសាសូមេបដែលចាប់ផ្ដើមដុសវា8មីលីក្រាមក្នុង1គីឡូដែរ
Okay, and finally, we should know the complications of SARS-CoV. They often cause the hypercoagulopathy that will produce thrombosis and cause pulmonary embolism or acute coronary syndrome. And it also causes cardiac dysfunction and such as myocarditis or arrhythmia. So when patients have complications, we should draw the biomarkers such as D-dimer, fibrinogen, and the cardiac enzyme, and the CRP, etc. Please translate.
អានេះ complication របស់វាប៉ះពាល់ទៅលើ organ របស់យើងសំខាន់មាន4ហ្នឹងហើយយើងចង់ដឹងវាប៉ះពាល់អីខ្លះយើងមើលថែមទៅមាន4ដូចក្នុងរូបហ្នឹងណា មានបេះដូងមានអី complication របស់វាសាហាវដែរយ៉ាង Okay, continue, doctor.
Okay, that's summary when we talk. The first, when we take care COVID-19 case, we should make sure the unit stay and the symptom onset day is day 0. And then we should realize the patient vaccination status and the risk factors for severe COVID-19. And then we should apply medications as soon as possible in mild to moderate COVID, such as Paxlovid and remdesivir and molnupiravir. And then when the patient present with severe or critical COVID, we should give them dexamethasone first, and then remdesivir and tocilizumab. That's what I talk today. Thank you for listening.
ចានេះគាត់ summarize របស់យើងទី1គាត់ឲ្យមុនយើងព្យាបាលហ្នឹងយើងត្រូវ make sure ពីថ្ងៃរបស់នៃការចាប់ផ្ដើមរបស់ជំងឺហ្នឹងពីអ្នកជំងឺបានយើងត្រូវច្បាស់អ្នកជំងឺហ្នឹងបានចាក់វ៉ាក់សាំងstatus របស់គាត់ហ្នឹងចង់និយាយថាគាត់ចាក់បាក់វ៉ាក់សាំងម្ដងអញ្ចឹងទៅហើយមួយទៀតនឹងអ្នកដែលប្រឈមមុខទៅនឹងអ្នកដែលអាចកើតទៅជាវិវត្តទៅរក COVID-19 ធ្ងន់ធ្ងរហ្នឹងដូចយើងបានរៀនខាងលើមកអញ្ចឹងមានអ្នកអីទឹកនោមផ្អែមអ្នកធាត់ហួសមានស្ត្រីមានផ្ទៃពោះមានអីហ្នឹងហើយទី2ការប្រើប្រាស់ថ្នាំឲ្យបានត្រឹមត្រូវចំពោះអ្នកជំងឺដែលមានសភាពស្រាលឬក៏មធ្យមយើងអាចប្រើនេះមានPaxlovid ហ្នឹងហើយ remdesivir ហើយ molnupiravir ហើយទី1ទី2ទី3យើងបើការប្រើប្រាស់ថ្នាំទៅលើករណីដែល severe ឬ critical ហ្នឹងដុសដំបូងគេឲ្យយើងប្រើដាច់សារបន្ទាប់មក remdesivir ឬក៏ tocilizumab ហ្នឹង Thank you doctor.
Okay, thank you all.
Okay. We said Dr. Chen's speech and all the doctor in the body, the Dr. Chanda and thank you Lina for translation. So now we are open for and do you have any question want to ask Dr. Chen?
ឥឡូវគាត់សួរដល់គ្នាយើងឲ្យមិនសំណួរឲ្យឆ្ងល់ចង់សួរគាត់ឲ្យសួរបានឥឡូវមានផ្ទុះ COVID ព្យាបាលអីទៀតយើងឆ្ងល់ទៅព្យាបាលមកទៀត
Hi Dr. Chanda.
ជាង 94% បាទហើយយើងមានអសិលផលបើសិនយើងវាស់ទៅឃើញ Doctor Sauchanta,
please.
I have one question. He want to ask you that if the patient they come to admit at hospital, then we check the oxygen saturation below 94%. So we in hospital no X-ray to check patient. So how can we categorize the patient severity? How we can categorize the patient get severity?
他说当人们照 X 光，RC 确定小于94，他说怎么决定他们的严重度？
小于90就严重了。
对，他有这个问题。
Okay, when patients present pneumonia on chest X-ray and they also have the saturation below 94% unrelated, that's the definition of severe COVID.
But in hospital, no X-ray for check lung patient, and we have only check the oxygen sat finger. So how can we know the patient?
Oh yeah, this time is difficult to define, but maybe we can take that on the respiratory rate, or maybe you can use your stethoscope to listen your lung breathing.
So is that answers okay for you?
So you can use stethoscope for hearing the breathing sound, and you can keep an eye on the respiratory rate to see if there are any dyspnea for the patient. Then if you don't have chest X-ray for the plain film test, is that fine for you?
Sorry, doctor, can you clarify again?
Can you speak again? Nina, can you repeat your question again?
Yes, I want doctor clarify again, doctor.
Okay, fine.
Because our internet difficult to listen.
Okay. So how about, do you have another question? Okay, thank you. So maybe this is the first time we use internet, so we have some technical problem. But I think in the future we may have another meeting. So we can finish today's meeting. And if Nina, if you have any question, you can just email to me. Then I can have Dr. Chen to answer you. Okay. So that's
okay.
So I'm very happy to see Dr. Changda and Nina and everyone again. So today we thank the speaker, Dr. Chen, and our department, Pediatric Department Section Chief, Dr. Zheng. And so we ending today. So bye-bye.
Bye bye. See you next time, doctor. Good luck.
Good luck.
Okay.
Bye-bye.
Take care.
Bye, Dr. Kevin, and all of you. Thank you so much. See
You are
you
welcome.
You're
in
welcome.
Cambodia.
Hope to see you soon.
Yeah, we hope can go to Cambodia again.
Yeah.
Okay, bye-bye.
Okay,
Bye.
keep in touch.
Bye. Bye.
Stay and okay, bye bye. 后来蛮顺，
对
对。
就跟影像